The Delta variant and vaccine protection. Hey YouTube fam, welcome back to One Healthy Life. Today, we will be talking about the Delta variant and vaccine protection. Before we start, I would want you to hit that red subscribe button so that you never miss out on any of our videos. This video will be super informative, and please make sure to subscribe to our channel. Now, without any further delay, let's get into the video. On July 27, 2021, CDC released updated guidance on the need for urgently increasing COVID-19 vaccination coverage and a recommendation for everyone in areas of considerable or high transmission to wear a mask publicly indoor places, albeit they're fully vaccinated. CDC issued this new guidance because of several concerning developments and newly emerging data signals. First, an enormous increase in new cases reversed what had been a mild decline since January 2021. Within the days leading up to our guidance update, CDC saw a rapid and alarming rise within the COVID-19 case and hospitalization rates around the country. In late June, the 7-day moving average of reported cases was around 12,000. On July 27, the 7-day moving average of cases reached over 60,000. This case rate looked more a bit like the speed of cases we had seen before the vaccine was widely available. Second, new data began to emerge that the Delta variant was more infectious and was leading to increased transmissibility as compared with other variants, even in some vaccinated individuals. This includes recently published data from CDC and our public health partners, unpublished surveillance data, which can be publicly available within the approaching weeks, information included in CDC's updated science brief on COVID-19 vaccines and vaccination, and ongoing outbreak investigations linked to the Delta variant. Delta is currently the predominant variant of the virus within the US. Below could also be a high-level summary of what CDC scientists have recently learned about the Delta variant. More information are getting to be made available when more data are published or released in other formats. Infections and spread. The Delta variant is more contagious. The Delta variant is very contagious, quite 2 times as contagious as previous variants. Some data suggest the Delta variant might cause more severe illness than previous variants in unvaccinated people. In 2 different studies from Canada and Scotland, patients infected with the Delta variant were more likely to be hospitalized than patients infected with Alpha, or the primary virus that causes COVID-19. Even so, the overwhelming majority of hospitalization and death caused by COVID-19 are in unvaccinated people. Unvaccinated people remain the simplest concern. The simplest risk of transmission is among unvaccinated folks that are much more likely to urge infected and thus transmit the virus. Fully vaccinated people get COVID-19 less often than unvaccinated people. People infected with the Delta variant, including fully vaccinated people with symptomatic breakthrough infections, can transmit the virus to others. CDC is constant to assess data on whether fully vaccinated people with asymptomatic breakthrough infections can transmit the virus. Fully vaccinated people with Delta variant breakthrough infections can spread the virus to others. However, vaccinated people appear to spread the virus for a shorter time. For prior variants, lower amounts of viral genetic material were found in samples taken from fully vaccinated people that had breakthrough infections than from unvaccinated people with COVID-19. For people infected with the Delta variant, similar amounts of viral genetic material are found among both unvaccinated and fully vaccinated people. However, like prior variants, the number of viral genetic material may go down faster in fully vaccinated people as compared to unvaccinated people. This suggests fully vaccinated people will likely spread the virus for fewer time than unvaccinated people. Vaccines. Vaccines within the US are highly effective, including against the Delta variant. The COVID-19 vaccines approved or authorized within the US are highly effective at preventing severe disease and death, including against the Delta variant. But they're not 100% effective, and a few fully vaccinated people will become infected and acknowledge illness. For all people, the vaccine provides the only protection against serious illness and death. Vaccines are playing a crucial role in limiting spread of the virus and minimizing severe disease. Although vaccines are highly effective, they're not perfect, and there'll be vaccine breakthrough infections. Many Americans are vaccinated, which number is growing. This suggests that, albeit the danger of breakthrough infections is low, there will be thousands of fully vaccinated people that become infected and ready to infect others, especially with the surging spread of the Delta variant. Low vaccination coverage in many communities is driving this rapid surge in cases involving the Delta variant, which also increases the possibilities that even more concerning variants could emerge. Vaccination is the simplest way to protect yourself, your family, and your community. High vaccination coverage will reduce spread of the virus and help prevent new variants from emerging. CDC recommends that everyone aged 12 years and older get vaccinated as soon as possible. Masks. Given what we all realize, the Delta variant, vaccine effectiveness, and current vaccine coverage, layered prevention strategies, including wearing masks, are needed to reduce the transmission of this variant. As of now, as we build the extent of vaccination nationwide, we must also use all the prevention strategies available, including masking indoors in public places, to stop transmission and stop the pandemic. Everyone who is during a position, including fully vaccinated people, should wear masks publicly indoor places in areas of considerable or high transmission. COVID vaccines protect against Delta, but their effectiveness wanes. Massive UK study of COVID-19 cases shows that people who are jabbed have good immunity initially, but quickly become more vulnerable to the fast-spreading Delta variant. The Pfizer-BioNTech and Oxford-AstraZeneca COVID-19 vaccines are effective against the highly infectious Delta variant of SARS-CoV-2, but their protection drops away over time, a study of infections within the United Kingdom has concluded. Researchers at the University of Oxford, UK, and therefore the country's Office for National Statistics, analyzed a huge dataset comprising the results of 2,580,021 PCR tests to see for SARS-CoV-2 from 384,543 UK adults between 1 December 2020 and 16 May 2021, when the Alpha variant was dominant, and 811,624 test results from 358,983 people between 17 May and 1 August 2021, when the Delta variant was more prevalent. The results, published during a preprint on 19 August, suggest that both vaccines are effective against Delta after 2 doses, but that the protection they supply wanes with time. The vaccine made by Pfizer in New York City and BioNTech in Mainz, Germany, was 92% effective at keeping people from developing a high viral load, a high concentration of the virus in their test samples, 14 days after the second dose. But the vaccine's effectiveness fell to 90%, 85%, and 78% after 30, 60, and 90 days, respectively. The vaccine developed by Oxford and thus the pharmaceutical company AstraZeneca in Cambridge, UK, was 69% effective against a high viral load 14 days after the second dose, falling to 61% by 90 days. The drop by effectiveness shouldn't be cause for alarm, says Sarah Walker, a medical statistician at the University of Oxford who led the study. For both of these vaccines, 2 doses are still doing very well against Delta, she says. Peak levels. The study shows that vaccinated folks that become infected with the Delta variant carry high peak levels of the virus. When the Alpha variant was dominant within the UK, vaccinated people that became infected had much lower peak viral loads. The implications of this aren't clear, Walker says. Most of our tests are monthly. We can't really say considerably within the least about how long people are infectious for, and particularly whether that's different with Delta, she says. Anyone who thinks that if they get infected having been vaccinated, they can't transmit, that isn't likely to be true. The data also suggests that the time between doses of vaccine doesn't affect vaccine effectiveness, which people that have previously tested positive for COVID-19, also as receiving 2 vaccine doses, have the simplest protection against future infection. The analysis focused on the 18 to 64 age bracket and didn't check out hospitalizations or fatalities, points out Devir Aran, a biomedical data scientist at Technion, Israel Institute of Technology in Haifa. This study is about infection, not severe disease, he says. The results copy observation from Israel, which vaccinated its population very early within the pandemic, he says. We are seeing high levels of breakthrough infections within the population that was vaccinated early, and, on the other hand, we are seeing robust protection in those vaccinated recently, especially in 12 to 15-year-olds. The results raise questions on whether it might be simpler to possess doses of various vaccines instead of multiple doses of an equivalent one, especially if a third booster dose is to be considered. Georg Behrens, an immunologist at Hanover School of Drugs in Germany, says that mixing vaccines could increase their effectiveness. The system reacts differently to different types of vaccine, and this might be exploited to trigger a far better overall response. Using a vector-based one first, then something that has no vector, but an equivalent antigen, absolutely is sensible, says Behrens. I will be honest, this situation feels like a loop. Like everyone is so frustrated and can't handle the situation, even though I think that this is the hardest phase of my life, and I want to know your life stories during this corona spread, so let me know in the comment down below. With this, we come to the end of this video. I hope you enjoyed watching it and it was informative enough. If you enjoyed watching it, make sure to hit that bell icon and subscribe to our channel to never miss any updates from One Healthy Life. We will be back soon with another fun video. Till then, take care.